Have you ever wondered if medical coding is a good career? Well, if so, you are in the right place, because today I'm going to break down what is a career in medical coding, what does it look like, and that way you can make the best decision about if this is the right career path for you. Hey there, I'm Victoria. I'm a medical coder, auditor, educator, and content creator, and on my channel I provide tips, tricks, and tutorials to help you be successful in a medical coding career. If you haven't already, I would highly encourage you to subscribe, because if you do decide that you want to do medical coding as a career, you're going to need all of my different tips, tricks, and tutorials. Today's video is sponsored by Preppy, but more on them in just a little bit. Medical coding is about more than just looking things up in books and assigning diagnoses and procedures. It's about translating all of these different medical reports and converting them into unified code sets so that we can use that for important data and as well as things like medical billing. But why is this so important, and is this a good career? So let's break some important factors down. First up, let's address one of the top things on people's minds, and that's job stability. So our healthcare industry is blowing up. We have a huge aging population and a lot of healthcare consumption. And that means we have a lot of medical needs and a lot of medical data that needs to be quantified. Not to mention the fact that it's also getting more complex, which means we need very skilled medical coders to be able to navigate all of these nuances of different coding guidelines, insurance guidelines, and government guidelines. A lot of people have been very apprehensive, especially in the past year or two, about the advent of artificial intelligence and how that is going to impact the medical coding careers. And yes, while artificial intelligence is seeping its way into medical coding, it is actually a very good thing, because there has historically been what they've referred to as a shortage of medical coders. And with this heightened level of skill needed, and eye and attention to detail on these medical records, as well as the complexities going on and the changing factors that are happening, we need some assistance. We cannot handle the amount of volume of all of these different medical records and bills and everything going out without some sort of assistance. And historically, we've always had that. We've had different tools, different electronic tools, computer-assisted coding, but we need artificial intelligence to keep up the pace with making sure that everything is done. However, artificial intelligence is not going to replace medical coders. If you think about something like how an accountant uses QuickBooks. QuickBooks is a tool that helps them with their accountant. It can help quantify things, it helps keep track and calculate, but it still needs that eye of someone, usually a professional accountant, to look over things and make sure that they are correct, because you can't just go through everything on QuickBooks and then file your taxes. You want someone who's a professional to look at them, right? So with all this vast consumption of healthcare, we've got this need for speed, and that's where artificial intelligence is going to come in and say, hey, based off of this is what we think the codes are, and then have the certified coder who knows all of the different ins and outs, and if something changed last week, what the final code selection should be, or if the rationale of the AI tool doesn't quite add up to what it should be. So it will really help us be a lot more efficient, and there's a lot of people out there who are also hoping that it will help reduce the amount of offshoring of medical records and offshore coders. And if you're worried about something even like socialized medicine, keep in mind that this is not just for billing purposes. We also have to have that data so we can quantify how many people have certain diagnoses, how many are getting exacerbations of those diagnoses, how many are advancing to different stages of cancers, and that's all collected within our medical coding. Not to mention, even if we were to go to socialized medicine, that doesn't mean it's a free-for-all. We get to bill whatever we want to the government. It still has to be billed accurately so that providers aren't abusing the system and getting too much money and just billing whatever they want out. So there is still a need to make sure that we have everything accurately reported out, as well as for budgeting purposes. So we need to make sure, if we were, again, to go to socialized medicine, to see, okay, well, how much is this costing us to take care of this population of people, and, you know, make the appropriate budgets based off of that information. And we need that codified data to do that. Okay, now let's talk about work environment. There's a lot of different organizations that medical coders can work for. Hospitals, large healthcare institutions, small doctors' offices, insurance companies, workers' comp, even automobile or lawyers' offices. I know some people that do a lot of things in the legal realm. But most medical coders actually work from home. The recent AAPC salary survey that polled all of the members of the AAPC, which is the largest credentialing body of billers and coders, says that the majority majority of the membership that they have is either working from home or working hybrid. There's only a small amount that are working 100% on site. Now, having said that, while working from home as a medical coder, most employers want you to have usually a set schedule. So they won't have you be as flexible as like, well, I'm going to work 2 hours here and 3 hours there and 4 hours here, and it's not going to matter as long as I get my 40 hours in. They usually want you to have a regularly designated start and stop time, but they're flexible in most cases as far as if you want to start a little bit earlier on certain days or a little bit later on certain days. Maybe your kid has soccer practice. You need to leave a little bit earlier on those days, but make it up during other times. But most employers want you to be available during typical business hours. And this is an hourly position, and there are accuracy and productivity standards to meet. So when you're sitting down, they want you to be focused on medical coding. They don't want you to be doing things like taking care of small children or elderly parents. And a lot of employers do actually have policies stating that you are not permitted to do that while you are working from home. And the reason for that is because it kind of can drag your attention away from things like your accuracy and productivity standards. And again, you are hourly. So while you're on the clock, you're expected to be dedicated to working at your job. But there are some employers that are amenable to making some exceptions, that they might allow you to have your kids at home if they're able to entertain themselves, or you can be taking care of elderly parents. But those are really more so the exception than the norm. So I'm not saying never, ever, ever, but I am saying that it might be a little bit more difficult to find employers that are more amenable to you taking care of especially a small child while you're working at home. Now let's move on to salary. Medical coding has usually a pretty competitive salary. Most medical coders make around the $50,000 mark. However, it is usually lower to start out, but there is a great career ladder. So it doesn't take much to move up. And of course, there's a lot of factors that can play into that, like where are you located? How many years of experience do you have? What certifications do you have? I would suggest check out the AAPC salary calculator. I will link that below, and it will give you the information about your years of experience and certifications and your area. And I will say, for those of you that are located outside of the United States, if you're in, for example, India or the Philippines, typically they do not make as much as US coders, and they will not pay someone who is outside of the United States what they pay someone who is located in the United States. There's a lot of complexities that I don't understand, ins and outs of work visas and what has to go as far as HIPAA regulations and agreements and so forth. But I will say that the reason that a lot of places want to hire coders that are outside of the US is because they don't have to pay them as much, and then they have that cost savings. So if they would have to hire someone from outside the US and pay them as much as they would a US-based coder, they're just going to hire US-based coders. If you want to find out more about salaries in medical billing and coding, definitely check out this video that I'm going to tag up here as well as link below, because I have a video that really breaks down all of the different salary information. Now, what does it take to become a medical coder? Typically, you will need a certification such as the CPC. That is the most popular and widely accepted certification, which is where our friends at Preppy come in. Preppy has a top-notch training program for medical billing and coding, and they provide you all of the tools and resources that you will need to study for this at home, at your own pace, and without going into student loan debt. The program is very affordable, and it offers a lot of resources that you won't find other places, such as an externship, and there's some students that even qualify to get a laptop included in their program. You can find out more about Preppy or just about a career in medical coding in general at my free career masterclass at medicalcodingmasterclass.com. Now, one of the things I do want to stress about medical coding is that there is no program that in and of itself you finish it and now you're a certified coder. You can get a certificate of completion from most programs, and that's what you get if you finish AAPC training. If you finish Preppy, if you finish a college program, you get like a certificate of completion. But that's not the same as being a certified coder or a CPC. The only way to become a CPC is to sit for a proctored, very official, very strict exam and pass it at a 70%. And most employers are looking for that. They're looking for a certification either through the AAPC or the AHIMA or a HEMA. If you want to work strictly in medical billing, oftentimes that certificate of completion is fine, that you don't need to get a certification like a CPB. But for medical coding, they you really, really want those AAPC or those AHEMA certifications. For example, years and years ago when I went through training, I went through my local community college and received a certificate of completion as a medical insurance billing specialist. It wasn't until I got a job in the revenue cycle doing charge entry and was working at that for a while that I got the opportunity to train as a medical coder and get my CPC. And it wasn't until I did that that I was a certified coder. It's somewhat similar to when you're training to become an LPN. You complete that training in practical nursing, but until you actually sit for your NCLEX and pass that exam, you're not a licensed practical nurse. And most people aren't going to hire you unless you have that LPN license, right? However, unlike nursing, medical coding isn't regulated. There's no license or board certification or board exam or state board. There's really no governmental oversight or regulation when it comes to medical coding. It's really just a company that has a certification exam. And that's one of the reasons that many employers will institute their own proficiency exam so that they can determine who of their candidates is actually skilled in medical coding versus who was maybe just really good at passing exams and was able to pass their CPC certification. So is medical coding a good career choice? Absolutely. There is competitive salary, there's flexibility, there's a lot of job stability in healthcare, and there's lots of great training programs out there like Preppy that can help prepare you in a relatively short period of time. However, it does require a lot of training and a lot of dedication and continuing education. So if you're someone that doesn't want to have to continue committing time outside of your work hours to doing things like continuing education or staying up to date on things, it might not be the best fit for you because you do need to implement things like strategies on networking, especially if you're looking to advance in your career. So if you're not someone who wants to spend a lot of time reading through lots of reports and doing those analytics, and you don't want to have that continuing education, you kind of want to have to learn something once and then be kind of done with it, medical coding might not be for you, and that's fine. It doesn't have to be for everyone. I'm not trying to push everyone to become a medical coder. I'm just simply wanting to relay what this job is like, and then you can make the decision for yourself. But if you are ready to start your journey into medical coding, definitely check out my career masterclass at medicalcodingmasterclass.com. Otherwise, I will see you guys in the next video. And until then, just keep on coding on.